And I'd like to introduce you to something rather special. It's a new generation treatment device for radiation treatment for intracranial treatments. And it's really been the mission of John Adler, who you might know, some of you in the audience, invented the cyberknife. And he's now had another vision, so this is his second child. He really believes in his vision that not enough people around the world get intracranial radiosurgery, and that problem needed to be addressed. And one of the main reasons was accessibility, and it's a really tough treatment, so it was the difficulty of doing that treatment. So he designed a machine to get around these sort of boundaries to treatment. So he came up with this unique design to give the opportunity to treat patients with radiosurgery rather than surgery, because it's now very clear from the data that the outcomes are very actable in many disease types, and also there is a reduction in the negative side effects of treatment often favor radiosurgery. On the social effect to patients, the well-being after the procedure is critically different. It is a long recovery time for most surgery. From radiosurgery, you can just get back to everyday life. Also, there's a huge cost difference between the actual delivery of the treatment between radiosurgery and surgery. It also gives you the opportunity with busy departments to release patients for other surgeries that are not suitable for radiosurgery. And finally, the social impact on the patient is often forgotten. But if a patient can return to work quickly, that's feeding their families, or they don't need carers at home to look after them. And after radiosurgery, you get back to work immediately. Unfortunately, after surgery, you could be weeks or months away from work. So the sort of things that we can treat with radiosurgery is selected malignant cancers, benign cancers, metastatic cancers, and also vascular disorders like AVMs. We're also moving into the functional world where you can treat trigeminal neuralgia and essential tremor. And this is one of the areas where we're really increasing. And you can see here, there's quite a long list, but this is all works in progress at the moment, where we're looking specifically at ways of treating these disorders. And personally, John Adler's working on addiction program with Stanford University, where they've currently just finished a trial with pigs and now are moving to humans, where they might be able to stop addiction maybe to alcohol. One of the other big increases has been really the advances in immunotherapy. This has really changed the life expectancy of many patients, so we're getting a lot more metastatic patients, and they're often getting cancers not just once but multiple times. So you can have multiple mets multiple times. So you really want to protect the healthy brain when you're doing that. And then you can see where all of the sort of tumors come from. This is a graph of all the primaries. And then you can actually look at a paper published recently. You can see how extended the lifetimes of patients are. So you're looking 1.7 years as a minimum. So you really want to look after the patients that get brain mets. And then, obviously, traditionally, we used to give whole brain radiotherapy. This is a graph really showing that you shouldn't really treat the whole brain. You should treat each independent tumor independently. So, this is the device we came up with. And it's unique. It's the first radiation treatment machine in the world not to need a bunker. So you've got daylight. This is the one in Munich. And this is it from the outside. So they just literally put an extension on the building. But it also brings green issues. It costs about 300 motor vehicles equivalent for a bunker. With our machine, you don't need a concrete bunker. It also means that you don't have to walk out of the room. You imagine when you treat the patient, you run in there, you set them up, and then everybody leaves the room. With our machine, they don't. They just sit down next to the machine. And it has a virtual area here in the light blue that if you walk there, it just stops the machine. And of course, we've had lots of added benefits. Unfortunately, patients get sick during treatment, and we are literally with the patient in seconds, and there's a manual release, and you can get patients out very quickly. And that could be huge cost savings as well, because if the machine gets contaminated, it could be out of action for 2 or 3 hours while you clean it up. So that's been an aside we found. If we look at some of the components of the machine quickly, and I've got a video in a minute to sort of show you it in action. This is a traditional axial gantry that you see on conventional linear accelerators. And what we've done is we've added an oblique gantry, and this is what gives it the gyroscopic approach. So it delivers from many angles, giving you many beams. Then you have the sphere that holds the radiation, and then the rotary shield that goes round the patient once they're in the machine, and then finally the door closes behind it. Also, very importantly, is the table. Because it's integral with the system, it means it's extremely stable and extremely precise, sort of 0.1 of a millimeter accuracy. We then have a specific imaging system that you use to set the patient up, ready for treatment, and then monitor them constantly through treatment. We have our own linear accelerator specifically designed for intracranial patients, and that means it's a lower energy, so all of the energy goes into the target, not into the healthy brain. And we have a collimator, again, deliberately designed to protect the patient, because they're not all malignant patients. Some of your patients could live 50, 60 years after treatment, so you want to keep the whole body down just like you do in radiology. And then finally, we have a dose monitoring panel, so it actually records what you're delivering shot by shot. So there should be a video now to play. That was the plan. Hello?
Páni, technicky by sme možno potrebovali niečo spustiť. A už to ide, ďakujem.
I think it's really important to show the image so you can see what it looks like. It does look quite space age, but if you know the CyberKnife, you'd expect that from John Adler. And you can see a little green glass window there. That's actually a window into the machine, so you can see inside. And again, this has had benefits where patients have had their family sitting in the room if they were young and nervous. It really just makes the treatment much nicer. So now you've had the door closed, the patient's in the machine and ready for treatment. This is the collimator that just turns around, changing the actual accuracy of the collimator from 4 to 25. And because we're treating the head, it's much closer to the patient, so there's less divergence of the beam. So it keeps that leakage down to the patient to a very low level. And then when it comes to the setup, you can see that it uses X-ray source, and we take images, we compare them with the treatment plan that's designed before the treatment. We set the patient up then with that DRR, and then once that's ready to go, we start the treatment, and then it continuously monitors throughout the treatment, making sure that the delivery is exactly what you prescribed. And you can see here how the couch moves, so you can move between each shot, making the patient setup completely seamless and integrated. This is probably the coolest bit. You can now see as the machine rotates, this is the gyroscopic nature of the machine, and this is what gives it the ability to attack from so many angles. This gives the ability to deliver the maximum dose to the target while sparing the healthy brain. And again, you can see how the beams come from so many angles. And we've just literally gone from 260 beams to over 300 now. And it's going to extend as we get round the anti-collision. If we could end the video there so I can sort of wrap up. And again, you can see the crossover shots there. So you're getting all of the dose into the target and saving the brain. Sorry about this. The best plans. I should have done the video at the end. So this is really showing the accuracy, because it's a brand new machine. It was very important to show you that it was really a good machine. And in the UK, they decided to have a national service where you had regional intracranial radiosurgery. So every hospital that wanted to do it had to tender for it. And part of the tender was they all had to do 6 benchmark plans. So everybody got the same patients to treat. And then they were going to look at how it worked. So you can see the results on the right there with all the different manufacturers, and you can see the Gamma knife is clearly the sort of gold standard currently in intracranial radiosurgery. And when you put the Zap-X into this graph, you can see how well the machine performs. It really is a gold standard. And we're at the beginning of our journey. This is today's machine. Most of our competitors' machines have gone 10, 15 years. We're just starting our journey. We've got cone beam CT coming on our machine and dynamic treatments. So everything is ready for the most astonishing new type of radiosurgery. Thank you.
Thank you very much for your presentation.